The rules say one. Honorable Member.
Okay.
Please proceed. Within
Thank you.
3 minutes.
Thank you very much, Honorable Speaker. Good afternoon to you. Good afternoon to all of us. Honorable Speaker, as Shadow Minister for Home Affairs, Immigration, Safety and Security, I hereby give notice that on Thursday, the 16th of October 2025, I shall ask my counterpart, Honorable Minister Lucia Ipumbu in absentia now, the following. Before I proceed, allow me to commend the men and women in uniform for their recent successful nationwide drug crackdown, which led to over 200 arrests and major seizures across the country. Their dedication to protect our communities and upholding the law deserves recognition under the circumstances. However, Honorable Speaker, despite these successes, the continued inflow of drugs, often involving foreign nationals, exposes serious weaknesses in our border surveillance, detection systems, and enforcement practices. During my recent oversight visit to the southern border posts in the Karas region, it became evident that non-commercial posts such as Klein, Manasseh, and Feroz Drift lack proper scanning or detection facilities. Officers are forced to conduct village-type manual searches, making it extremely difficult to detect narcotics concealed in vehicles, significantly undermining national security. I therefore ask my counterpart the following. Honorable Minister, given that non-commercial border posts have non-scanning or detection facilities and rely entirely on manual searches, and considering that what measures is the ministry putting in place to effectively detect and intercept drugs, and are current manpower and resources sufficient to address this critical gap? 2, how is the ministry improving coordination with other key ministries to ensure that foreign nationals arrested for drug trafficking are thoroughly investigated, prosecuted, and where appropriate, declared persona non grata to prevent them from re-entering our beautiful Namibia? 3, what concrete steps is Namibia taking to strengthen regional and international cooperation, particularly with SADC, to enhance real-time intelligence sharing and conduct joint operations against cross-border drug syndicates? 4, could the Minister update this House on the handling of confiscated exhibit materials, including drugs and vehicles, specifically how these are stored, accounted for, and disposed of once court cases are finalized? 5th, the last one, Honorable Minister, given speculation about known drug traffickers in Namibia who have not been pursued by police, could this inaction render authorities accomplices, and what steps are being taken to ensure accountability? Thank you, Honorable Speaker. I so submit.
Yeah. Honorable Member, thank you. Now, in terms of Rule 85.1, a mover of a question has 3 minutes per question, and the frequency is only once. So now you have fully used up your time for question. That would be the only question that I can admit. You may please table it. Yeah, to next time. No, not now. We only have one frequency. No, Honorable Venani. No, it's not allowed in the rules, because the rules only give flexibility to the presiding officer to extend the time. So that's why I allowed him to go above 3 minutes. But I cannot give him more than one chance to ask another question after the time is used. Yeah, Honorable Venani, you have the floor.
Less than 3 minutes. Yes, Honorable Speaker, I pray for your indulgence under Rule 135 to ask 2 questions, one to the Speaker under privilege, and another one to the Minister of the Exchequer or the Minister of Finance. The one to the Speaker, it is a procedural question. Madam Speaker, motions that are fully, or that were fully adopted by this House at a particular time, at a particular instance, and government deliberately refuse to act on an adopted motion in this House, what happens to those motions? If Parliament agrees, my phone is not here.
The Speaker.
It's the Speaker's phone. Madam Speaker, I'm asking this question in lieu of our constitutional order, that Namibians in their own volition through a national suffrage elects people's representative to come and represent them in this very august House. And members of Parliament take up actions on matters of policy to change the lives of the people of this country. Parliament adopts motion, and for years Parliament awaits government to act. What will the Speaker do to motions adopted in this House to which government has not acted upon? That's my first question to you. Question number one. I'll go ahead to the second one. I can. It's a point of privilege. Point of privilege. To Madam Minister of Finance, why are you punishing farmers? That when a farmer buys a commercial vehicle through a pickup, or what you would term a bakkie in our language, a farmer buying a bakkie on his farm can be able to claim tax rebates on that vehicle as a depreciation value. But when a farmer buys a double cab, using that double cab to carry family to the farm, and also a trailer to pull whatever leaks and things, that double cab is seen as a luxury vehicle as opposed to a farming tool. Having made a very summative assessment, more farmers now are using double cabs because it's a car that can be used for easier farming. You can carry the family, you can pull the trailers, and you can be able to farm with it as a bakkie. So when will the Minister of Finance come to the rescue of farmers to say that a double cab Land Cruiser or a double cab Toyota or a Ford Ranger, whatever, and if you are having a farming operation, you can still be able to farm and use this bakkie as a farming tool, as opposed to classifying it as a luxury, because the double cab is not a luxury. So I thought I did not finish my 3 minutes. But since you have not seen me in a long while, I understand. Oh, I missed a deal.
Thank you, Honorable Member. Honorable Member.
No, I was having a death in the family.
Honorable Venani.
Yes.
It is my view as presiding officer that your last question, it does not qualify to be posed as an oral agent question. I think that's just a normal question on an issue that is of concern, that has been known to you, and you have an opportunity to post that question in writing. That's the first one. Second question. Now, with regards to the question on the point of privilege posed to the Speaker, that matter is dealt with in the rules, Honorable Speaker. All right?
Yes, you are correct. I'm supposed to be a speaker, don't worry.
Yes, Honorable Member.
I received that blessing.
Because I hear too much speaker in the House. Now, Honorable Member, the rules are very clear to say we have a standing committee on implementation, and the rules indicate that when a motion is adopted, it is required, but you cannot rise on a point of privilege to ask the Speaker to tell you which rule, because we had an induction program. But I will look for that rule and give it to you, but I just want to give you the ruling. There is a standing committee on implementation, and it is a provision of the rules that when we adopt motions here, the secretary would notify them to the accounting officer of the concerned ministry, who would then ensure that there is implementation, and that the implementation committee would receive reports from the standing committee on the implementation of the resolutions, and where there is no implementation, notices will be sent to the respective heads of the institution to bring that to their attention and demand implementation. So the elaborate provision that talks about that, I will look for that rule, which I don't have to do, Honorable Venani, but I will read it for you. But that's the answer. Yes, indeed, there are mechanisms. Whether that mechanism is sufficient is for us to tell by looking at our rules and determine whether we need to strengthen them. Yeah, so I have responded in that regard. Honorable Tuhezi, you have the floor.
Thank you so much, Honorable Speaker, for the floor. I'm standing on point of privilege. I'll fail in my duty as the Shadow Minister of Gender Equality and Child Welfare if I don't humbly request through you that the House observe a moment of silence for the young lady, Juanita Carros, the one who was recently murdered behind People Primary School and other victims of gender-based violence. I so submit, Honorable Speaker.
I think it's a humane thing to do, but I want to implore the members that please, if we want to organize for a moment of silence, we should pre-notify the presiding officer so that at the beginning we deal with it. Because if we stand individually and ask that we rise on a point, to observe a moment of silence, it would not flow well with what we are doing.
In future, we'll correct it next time.
Yes. Okay, maybe we will rise when we are about to go for the break.
Thank you very much, Honorable Speaker.
Yes. Now, Honorable Kandorodu. Yes, please.
Honorable Speaker, it's very disheartening to see an empty parliament. Let me give a standing ovation to the only executive member, Honorable Erika Shafuda, for being here, the only minister in this house. She knew that today they are accountable to the electorates. The rest, they have AWOL. They went to their farms to do their own business. This issue must be addressed and it cannot be allowed. We have, you can, it's a privilege, it's a privilege. We have organized ourselves to minimize questions in order to give enough time for responses from the executive branch. But yet, they decide to boycott Parliament and not to be answerable to the community. So, can the chief whip of the ruling party wake up from this long sleep of his and her duty and take this matter seriously? I so submit.
I recognize Honorable Cooper. What point is it?
Privilege.
Wake up now.
Honorable Speaker, these daily and weekly insults must end. I don't know whether he's a stranger in Namibia. There is a meeting going on with the President of Botswana and with the ministers of Botswana. As we are speaking, there is a renaming of a street to Sir Seretakama. To Sir Seretakama, they are there. Besides that,
Honorable members,
There is a binational commission.
honorable members, I can't hear you. Can we speak in turns, honorable members? We can't all speak at the same time. Yeah, Honorable Thomas, can you please take your seat? Please take your seat, Honorable Bishop. Honorable member, can you take your seat? Yes, Honorable Thomas, take your seat. Take your seat, Honorable member. Yeah, so Honorable Cooper, take your seat. Please take your seat. No, Honorable Thomas, take your seat. Take your seat, Honorable member. No, take your seat, Honorable member. Let's speak in turns. Please take your seat. No, Honorable Nashinge is raising on a point of order. Please, Honorable Chief Whip. Yeah, I need Honorable Nashinge. We cannot all get up and speak at the same time.
Thank you.
Yes. On what point are you raising?
Yes, thank you, Honorable Speaker. I just wanted to urge you to remind your House, to remind us how to maintain the decorum of Parliament. The good Honorable here, the Deputy Chief of the SWAPO Party, she's pointing her fingers at us, which is unparliamentary.
Okay, may you
It's
not
an
take
assault.
your seat?
Pointing fingers at the fellow members.
Okay,
is a serious
Honorable
assault.
member, okay.
Thank you.
Take your seat. Honorable member, before Honorable Kope rises, I agree with you in general to say that some of our conduct are not parliamentary. They are not aligned with the rules. But it's not only the pointing of a finger by Honorable Koper, it's also 3 or 4 MPs getting up. I have been talking about the violation of the rules, and I take your point to be an agreement that there is concern about the way that we as MPs observe and comply with our rules. So let's agree to be more compliant. Now, okay. Yeah, it's a point of privilege. Yeah.
Daily, on a daily basis, Honorable Speaker.
I don't know why I'm not hearing Honorable Cooper.
Honorable Speaker, those insults of sit down and shut up is very disrespectful. If you want to be respected, respect the other person as well, because we do not know how we will treat each other if in future. Now, Honorable Speaker, my point is, the ministers here.
Yes, proceed please, Honorable Member, and conclude.
There is a Namibia-Botswana binational commission ongoing, whereby the President of Botswana and President of Namibia is officiating. Then, it's not a renaming, it's the meeting, that's why these members are there. Honorable Speaker, when are you going to defend a member? And it's an ongoing insult, daily, weekly, by Honorable Hengari and Honorable Kandarodu.
Yeah, okay,
No,
Honorable Member, you have
we
made your
all
point.
can do that.
Please take your seat.
We all can do that, but we do not want to go down that low. No.
Honorable Member, can you now take your seat, please? Honorable Member, can you now take your seat, please? Honorable Member, can you sit down, please? Yeah, Honorable Member. Chief Whip, can you get the member to sit down? No. Yeah, Honorable Members, please, when you make a point of privilege, you raise your point and you take your seat. You cannot rise on a point of privilege and start to argue with other people. Really, we are causing unnecessary disorderliness of the House. Now, Honorable Herunga, you have the floor. No, not you, the Honorable Herunga. Honorable Herunga has the floor.
No, yeah, it's me.
Not Honorable Haikola, it's Honorable Herunga that has the floor.
Not
the
the
point
Haikola.
of privilege.
Not the High College Herunga. Honorable Speaker, we have got rules of Parliament that governs the absenteeism of members of Parliament. we all are aware of the fact that if you are absent from Parliament, then of course you must have a permission from your chief whip. So therefore, some members of Parliament, because they are alone in Parliament, they might not be familiar with the fact that if somebody is absent, it's because of one reason or the other, and that person has got a permission from the chief whip. So that is the information that I want to convey to this House and to members of public. So those that are not here, that are part of the Soko party, because they have a blessing from the office of the chief whip.
Thank you.
Yes. Thank you very much.
Thank you. Now, honorable members, I now have a list of MPs who want to make a point of privilege, which is very unusual, because I now have a list of 1, 2, 3, 4, 5, 6, and Honorable Haikora is the last on the list of people wanting to make a point of privilege. And I want to say you are the last. I'm not going to admit anyone, so I'll start from the beginning. Honorable Nekongo, followed by Honorable Mombita, followed by Honorable Baloti, Honorable Kalangura, Honorable Embura, Honorable Aikola, and I close the list there because we must go on the program. Honorable Nekongo. Yeah.
Honorable Speaker, I stand on the point of privilege.
84.
The rules is known.
It's 84.
We know it, but I think I'm also, Honorable Speaker, ask members to be respectful to each other. Yes, when you are not, when you have never ruled, when you have never run government, you will never understand what is happening. SWAPO has promised the people, and the ministers are busy making sure that the bread and butter issues is attended to. So therefore, you cannot come here. You cannot come here and criticize that the ministers are not addressing. The ministers are busy addressing issues that you are asking in Parliament. So therefore, please allow SWAPO to deliver what it promised to the people.
Thank you. Thank you. I want to remind the members that they must be brief and to the point. We cannot use point of privilege to argue, to debate. We cannot. We raise an issue and you take your seat. Yeah, Honorable Mobita, please. Yeah.
I believe, Honorable Speaker, it might be pointless to belabor the point. Our ministers had a ministerial meeting this morning, and we have about 10 memorandum of understanding to be signed between Botswana and Namibia. And the sectors that the minister said are relevant to the signing of such memorandum of understanding. Secondly, in as much as I understand that we have a voluminous book of questions that need to be responded to today, I fully understand that. But we also need to acknowledge the fact that 9 out of 10, the people that ask the questions are sometimes not present at the time when the questions are supposed to be answered.
Honorable Member, you may now.
And that's a fact.
Yeah, thank you
that's
very
a fact of this House, and no matter how much we want to lie to each other, that's a fact.
Okay, Honorable.
But circumstances do prevail and present themselves at a time like this, where government is exposed to another government.
Okay,
and
Honorable Member, please.
I thought
you have made your point.
Thank you.
Yeah. So now, Honorable Members, I have already said that I have drawn a line after Honorable Haikola, and they set the clock 1 minute for each. Every time the 1 minute lapses, you switch off the mic, because we cannot debate under privileges. Now, Honorable Baloti is not here. I call on Honorable Karangura. Front desk, set the clock.
Thank you so much. Am I protected, Speaker?
Yes, go ahead.
Thank you so much, Honorable Speaker. I just want to plead to be given that opportunity to remind the House that we have sworn under oath to protect the Constitution of Namibia. And Article 41 says ministerial accountability. All ministers shall be accountable individually for the administration of their ministry and collectively for the administration of work of the cabinet, both to the president and to parliament. I think this is the time we come to our senses that executive should respect parliament, because they are accountable to parliament. And on a day like this, on a Thursday, they should be here to answer the question, which is the only day that they are accorded and are supposed to be here for accounting purposes. Now, the executive should make arrangements not to fall on a Thursday when they are needed in this house. Yeah, it is unfair that we have a book this thing, and every time there's an excuse that they are not here for some sort of reason that the executive has planned on. We need to respect Parliament, and this is the reason why we need separation of power.
Okay, thank you so
Honourable
much. Member. Now, honourable members, honourable members, if the point of privilege that the remaining members want to make is about the attendance of the members of the executive, I rule that that point has been made, and I'm no longer going to accept any point of privilege on that point. So now I am calling the member. If your point of privilege is on that point, I will rule you out, because we have made that point already. Honorable Balotti is not here. Honorable Haikola.
Okay, Honorable Speaker, please don't rule me out.
No,
Mine
so long as it's not on the attendance.
No, it's not. I'm also asking nice, like Honorable Emma, your fellow Speaker. So, the thing is, today is Thursday, Speaker. It wouldn't have hurt to just communicate.
Honorable member, you are out of order. Out of order, honorable member. We are done making that point, honorable member.
My Speaker?
My honorable member, I already ruled in the beginning that I am done dealing with the point of privilege on the attendance. We have, please take your seat. Let's proceed. So I'm not going to consider the remaining members since we are done now with that point. So now we go on with we were on notices of questions. Now we proceed notices of motions. Yes, on what is it? Not on the attendance, ne? Yeah, no, if it's not on attendance, I will not rule you out. No, don't just say what is your point about, honorable member. What is your point? Honorable member, can you just say what point you want to raise on?
Treat us equal.
Honorable member, that was just a violation of the rules. Now, notices of motions, honorable, please, let's proceed. No, honorable members, the presiding officer assigns the turns for people to speak. So, notice of motions. We cannot, honorable member, what point are you raising on? You are not assisting me to conduct the work of the House. So we are not going to talk on the attendance of ministers. So, honorable member, you have the floor. And please, members, the presiding officer assigns the turns to speak.
Thank you, Honorable Speaker. Members of the August House, I want to appeal on our joint sanity in terms of the way we probably inadvertently have been compromising the decorum of this House. We are being watched by our grandchildren. We are being watched by our peers.
You are not complying with the
That notwithstanding, they see the empty chairs as well, but they equally notice the way we have been behaving since the inception of the 8th Parliament of the Land of the Brave. May I appeal to your good sense that the Almighty has endowed us with, that we try as much as we may have differences. Obviously, there will be differences. Differences will be there, but let's try to behave with respect,
Thank you.
so that the ones observing us from afar would not be frightened. That's my appeal.
Thank you. Very important appeal. Very well received. Thank you. We proceed with notices of motions. Any notice of motions? Where is notice of motion? Yeah, Honorable who? Honorable Ricardo. Is that Honorable Ricardo? Yes, please, you take the floor.
Okay, Speaker. Thank you very much for the floor. Honorable Speaker, I hereby give notice that on the 16th of October 2025, I shall move that this House discusses the recruitment practices of the Minister of Environment, Forest and Tourism, particularly that applicants for positions such as rangers, assistant rangers, and laborers from Zambezi region must travel long distances to Rundu.
Honorable members, I am told that when a member takes the floor and the mic is on, the cell phone must be far. Otherwise, there will be that noise.
Can I repeat?
I don't know. Unfortunately, I'm not an IT expert.
Can
but
I
that's
start?
the advice I got from the technical people. Okay, proceed, Honorable.
All right. Can I start?
Yes, please.
All right. Honorable Speaker, I hereby give notice that on the 16th of October 2025, I shall move that this House discusses the recruitment practices of the Minister of Environment, Forest and Tourism, particularly that applicants for positions such as rangers, assistant rangers, and laborers from Zambezi region must travel long distances to Rundu or Ochwarongo for aptitude tests and interviews, a practice which imposes an unfair economic and social burden, and that this House considers measures to decentralize recruitment to regional centers in order to ensure fairness, equal opportunity, and effective conservation staffing. Honorable Speaker, I so submit.
The honorable member may now take the motion. Thank you. Honorable Minister of Finance.
Honorable Speaker, honorable members, very good afternoon. Very good afternoon.
Good afternoon.
I give notice that on the 21st of October 2025, I shall move that leave be given to introduce a bill to amend the Appropriation Act 2025 so as to increase and decrease certain amounts of money in the schedule to that act to meet financial requirements of the state during the remainder of the financial year ending 31st March 2026. I so move, Honorable Speaker.
Yeah, the Minister may now table the motion, please. Any ministerial statements? Reports from the Committee of the Whole Assembly and consequential proceedings. Now, before we go to the orders of the day, I would like to provide a ruling on the issue that the ruling was deferred on. It has to do with the question that was posed, notice of question by Honorable Kandorodu to the Minister of Justice and Labor Relations on 8th of October. And I wish to inform the House that it has been confirmed that the Committee on Poverty Eradication, Labor and Industrial Relations is in the process of finalizing its report on the impact of the outsourcing of jobs and services in the mining industry. The said report will be tabled in the Assembly in due course. Given that the matter that the member was querying about is therefore receiving attention, and therefore the notice of the member to put a question will not be admitted. Honorable Kandorodu, we wait for that report to come. If you find that there would still be issues that you want to query, you'll be free to put a question. So that's the ruling. We still have some time. Now we go to the orders of the day. The first notice of a motion is the one. Oh, yeah, today's Thursday. Yes, it's okay. You are correct this time around, Honorable Member. Yeah, today being Thursday, yeah, the first item on the agenda is the questions. Now, the first question, which is question number 3, is by Honorable Venani to the Minister of Works and Transport, who is unfortunately not here. Honorable Venani, do you put the question?
Now I have a point to make on a point of privilege, point of order under Rule 92. This question is older than 6 months. No, Speaker. I waited my chance, and as an experienced legislator in this House, I have to make this point.
Yeah, you make it on a privilege. You don't when you are called upon to put a question.
I cannot put a question that is as old as 6 months to a minister who is dodging. Every Thursday, Nekundi is not here. We have been, and he's running a very important department in government. For 6 months, that's why I've never asked additional questions. I can ask a plethora of questions. I don't do it because ministers do not answer questions. We have a whole Bible now, a barrage of questions not answered by cabinet. Cabinet is failing. Cabinet ministerial accountability.
Okay, Honorable Member, please take your seat. I also want to remind you that I have called upon you to put questions that are on the order paper several times and you were not in attendance. So the point, wait, Honorable Member, please, no, you are out of order. You are not giving the floor. You don't have the floor. No, Honorable Member. No, I have a right to hear you, but no, you don't have the floor. No, you are out of order. You are arguing with me as I'm making a ruling. You can't make a point of order when the presiding officer is speaking. No. No rule gives you a power to make a point of order when the presiding officer is making a ruling. The rules and orders say there will be silence in the House when the presiding officer is making a ruling. The presiding officer will be heard in silence. You cannot make a point of order when the presiding officer is ruling. Take your seat, Honorable Member. Take your seat. You are out of order. You are out of order. Honorable Member, I was making a ruling. You cannot make a point of order when the presiding officer is making a ruling. That is out of order. You can also not refer to Cabinet as a... Yes, point of privilege, Honorable Member. Point of privilege.
Point of privilege. Point of privilege. You know, sometimes we can really say things that have facts. But when you say the executive is useless, that cannot be condoned by anyone. What if I were to say, I almost said the same, but can you withdraw that one?
Yes, thank you.
That we are useless. We are not useless. We are useful.
Thank you, Honorable Minister. Honorable Minister, thank you very much. I think the Honorable Member, Honorable Venani, being a long-serving Member of Parliament and usually really someone who complies with the rules, will agree that it's inappropriate to use the kind of language that he did. Can the Honorable Member please just withdraw that one? Okay, the rules are saying when you withdraw, you are not to make any other remark.
I withdraw unconditionally.
Thank you. Now that is more like you. That's the way we are supposed to do. Now we were with the questions. Honorable Minister of Works and Transport is not here. The next question is also by the Honorable Venani to the same Minister of Works and Transport who is not here. The next question is by Honorable Sheundo, Binge Sheundo, to the Minister of Works who is not here. The next one is 24 by Honorable Thomas to the Minister of Urban and Rural Development, who is not here. The next question is by question number 28. Question number 28 by Honorable Motu to the Minister of Works and Transport, who is not here. The next one is 29 by Honorable Ipumbu to the Minister of Justice and Labor Relations. The Minister of Justice is here. Does somebody put the question on behalf of... No one is putting the question, Honorable Member, so you cannot answer. The next question is 62 by Honorable Muton to the Minister of ICT. Both of them are not here. The next question is 63 by Honorable Kalangula to the Minister of Works. Honorable Minister of Works is not here. The next one is 67 by Honorable Jonas to the Minister of Gender. The Minister of Gender is not here. The next question is by Honorable Mbula to the Minister of Works and Transport. The Minister is not here. The next question is by Honorable Susiku to the Minister of Health and Social Services. Now, Honorable Susiku, do you put the question?
I put the question.
Honorable Minister of Health, you have the floor.
Honorable Speaker, if I may be allowed, please, to respond to the question. My bag is just coming. If I can just get a moment, please.
Okay, thank you
very much.
So I think we come back to that question when the document.
Thank you very much.
Thank you. Then the next question is by Honorable Kalangula to the Minister of Works and Transport. He is not here. The next question is 75 by Honorable Thomas to the Minister of Education. Education is not here. The next question is 76 by Honorable Thomas. Okay, Honorable members, Honorable members, the Honorable Thomas is here. Do you put the question number 76, Honorable Thomas? The Deputy Minister is the Deputy Minister delegated? Can the Deputy Minister answer, please?
My light. I will not repeat the questions. With your indulgence, Honorable Speaker, Honorable Members, question number 1, answer to that question. The project in question was terminated due to the contractor's non-performance and quality issues. Therefore, following the termination of the contract, the Town Council of Ontangwa restarted the process of sourcing a new contractor to complete the remaining activities. 76. It's 76. 76.
What are you saying?
I'm responding to the mover don't know his own question.
Yeah, you are correct. Honorable Thomas, what point are you rising on?
76. It's them who are confusing Honorable Thomas.
Honorable Thomas, can you speak to the president? Honorable Thomas. Honorable Thomas.
Yes, she's correct.
Honorable Thomas,
She's correct, yeah.
you speak through the chair. Can you address me? What point are you rising on? Come again? Your mic is not on, I can't hear you.
I withdraw, you can continue.
You withdraw?
Yes, continue.
Okay, so that she can continue to answer question number 1.
Yes.
Okay, please. So the Deputy Minister may proceed, please.
So I was saying, as a result of a new contractor was then appointed in June 2025, and a site handover was held on the 2nd July 2025. Honorable, read your question. I'm answering. For your kind information, Honorable Member, that particular project was awarded to the initial contractor on the 8th of April 2021, with a commencement date being the 22nd April 2021 until 22nd November 2021, to be exact, 7 months. Unfortunately, Council granted an extension to the 31st of March 2022, following a time extension request from the contractor. The said extension of time was necessitated due to the delay of the land claims by the local church, which put Council in the position to redesign the road route, enter negotiations and compensations in that regard. However, even after that extension, the contractor still failed to complete the project timeously, and the following protracted delays. Thus, the contract was terminated in May 2024 after all legal requirements were covered. Answer to the third question. As I have indicated, the project was unfinished or delayed at the time due to the contract termination for non-performance and the process of sourcing a new contractor. Answer to question 4. According to our capital project records towards local authorities, we established the project was fully budgeted for and project funds were available for start to finish. Can you investigate the road and explain the steps? Honorable Member, I wish to appraise this August House that Ministry has inquired on the issue with Council and established that all necessary steps are done. Thus, all unfinished activities, which mainly were the paving of the pedestrian walkways along this road, is already under construction by a new contractor. I so submit, Honorable Speaker.
Well done. And what I would like to do is to ask that we observe that moment of silence before we break until 10 minutes after 16 hours. Then we will come back. The Honorable Bishop can ask a follow-up question if he has after that. Now we rise to observe a moment of silence and we extend our condolences to the family. Thank you. We now break for 15 minutes.
I want to appreciate the effort, and the answer also came to me. I don't have much question. I just want to implore the minister to go on the ground and familiarize with the current situation on the ground, and then come back to this August House again. Thank you.
Yes, thank you, Honorable Member. Now, I just would like to remind the Honorable Members that when a question was posed and it's answered, if there is an opportunity provided to the member, that opportunity is for the member to ask supplementary questions for clarification, not to make further comments. I took note of the comments, which are constructive, but please, the rules only allow for supplementary questions. Now, having said that, I was requested by the Minister of Health, or informed, that her answers are now here, and she's ready to answer the question posed by Honorable Susiku, which is question number 72. Does Honorable Susiku put the question? Okay, Honorable Minister of Health, you have the floor.
Thank you, Honorable Speaker, Honorable Members. I rise to address the issues raised by Honorable Boniface Susiku concerning the remuneration and retention of medical doctors in Namibia's public health sector. Very quickly, I'll get to question 1. Addressing the issue of competitive remuneration for public doctors is a top priority of the Ministry of Health and Social Services. Namibia is currently the second highest paying country in the SADC region for public healthcare workers, second only to South Africa. Nevertheless, we do recognize the need for continuous improvements, and we are actively engaged in finding and exploring alternative incentives, such as, firstly, student date cancellation incentives. The Ministry of Health and Social Services, in consultation with the Ministry of Education, Innovation, Sports, Youth, Arts and Culture, as well as the Namibian Students Financial Assistance Fund, to potentially offer either full or partial student date cancellation for doctors funded by NSFAF during their student training, who then dedicate multiple years of service to the public service following the completion of their medical training. Secondly, person-to-holder recruitment retention allowance. The Ministry is in liaison with the Office of the Prime Minister as well as the Ministry of Finance in order to ensure or consider ring-fenced incentives for the attraction as well as the retention of specialized skills in the sector. And then ongoing dialogues for reform are important. We continue our dialogues with key stakeholders to ensure that remuneration aligns with national priorities, career incentives and systemic sustainability. To conclude, the value of the doctors and healthcare workers cannot be overstated. Although we are the second highest paying in SADC, we do recognize the need to improve, and efforts are currently underway to ensure that that is done. With regards to question 2, the Health Professions Act 16 of 2024, specifically sections 39 to 41, introduce a mandatory period of service in the public sector for certain categories of health professionals before they are eligible to register as independent practitioners in the private sector. This landmark legislation, gazetted in December 2024, reflects the commitment to strengthening public healthcare system by ensuring that the country benefits from the expertise of health professionals, both in the public as well as in the private sector, particularly from locally trained professionals. Currently, the Ministry of Health and Social Services is in the final stages of developing and finalizing the implementation policies that align with this Act. These policies will ultimately define the operational framework in order for us to ensure that conditions, monitoring mechanisms, as well as institutional responsibilities associated with the mandatory service requirements are implemented and done so effectively. Beyond this legislative compliance, the Ministry recognizes that retention must not just be driven by obligation, but also by motivation and passion, and as such, we are undertaking several measures, not just to ensure financial compensation, but also to ensure long-term commitment and dedication to public service. This includes professional development opportunities, supporting postgraduate training, as well as specialist development, and sending healthcare workers to specialize on a yearly basis, improved working conditions by ensuring enhanced resources and infrastructure, incentive-based retention strategies, by implementing recognition awards and career advancement opportunities. We also hope to increase incentives for those working in the public sector. Then, with respect to question 3, Honourable Speaker, allow me to affirm that the recognition and incentives for healthcare workers, including those in the remote areas, are currently aligned with the government's existing rural allowance policy. This policy has been an important mechanism in acknowledging the additional burden as well as the sacrifices made by professionals that work under those challenging conditions. However, the ministry once again recognizes that more can be done in addition to this rural allowance policy in order to ensure that we empower them and they work in satisfactory conditions. As such, the ministry is in the process of drafting a proposal to be submitted to Cabinet, which seeks to recategorize healthcare workers as a distinct group based on their essential service status, the critical and scarce nature of their skills, their vulnerability to migration to both private as well as the international markets, and then to strengthen retention schemes tied to professional development and, most importantly, financial incentives for long-term service. Our intention is to build the framework that recognizes the sacrifice made by healthcare workers and to create a motivating environment that encourages loyalty and, like I said, long-term service. With regards to question 4, the ministry intends to formally engage NSFAF to explore innovative ways to align financial obligations with national service priorities. This is in order to reward loyalty and service to state, particularly in undeserved areas, to reduce the financial burden on healthcare professionals, and then to ultimately strengthen the retention of critical health workforce capacity within the public sector. In conclusion, Honourable Speaker, the challenges faced by our doctors as well as other healthcare workers are being addressed with a strategic, inclusive approach aimed at fostering a robust and committed public healthcare workforce. And there I wish to add that we recognize that not just compensation financially, but also creating a mentally stimulating environment where we allow them to feel safe mentally contributes towards motivation to work in the public sector. Thank you for your continued support. Thank you, Honourable Speaker.
Thank you. Honourable Sisiku, do you have any follow-up question?
Yes, Honourable Speaker, I have a few follow-up questions here. First, I would like to ask the Honourable Minister that does she agree that the main reason why doctors are leaving the public sector is due to poor incentives? And then the second one, she's saying she's trying to some efforts. Then she did not specifically mention what are those efforts that the ministry is doing. Not under your word. So I think maybe on those 2 points for now.
Thank you. Honourable Minister.
Thank you, Honourable Speaker. Thank you, Honourable Member, for the follow-up questions. I will quickly get to them. The first point you said, do I agree that doctors are leaving, going whether internationally or to private sector because of poor incentives? I believe I did highlight to state that despite the efforts, more can be done. We are aware of healthcare workers that have chosen to leave the public sector because they feel that they are greener pastures financially, and that is why we highlighted, despite the fact that we try to incentivize and we are second highest in SADC, we recognize that there is still a need to improve in order to ensure retention. I trust that answers the question. With regards to the second question that asks which particular efforts, I'm not sure if perhaps I was speaking too fast, because I did mention each of the efforts that the Ministry of Health, and I will mention them again for the Honourable Member's sake, and perhaps if you can take some notes. With that said, student debt cancellation incentives, firstly, because the Ministry of Health and Social Services, in consultation with the Ministry of Education, Innovation, Sports, Youth, Arts and Culture, as well as the Namibia Financial Students Assistant, to potentially offer either full or partial student debt cancellation for doctors who dedicate multiple years of service to the public sector being number 1. Number 2, person to holder and recruitment retention allowance. The ministry is in liaison with the Office of the Prime Minister and the Ministry of Finance to consider ring-fence incentives for the attraction and retention of specialized skills in the sector. And then I mentioned ongoing dialogues for reform, where we continue our dialogues with key stakeholders to ensure that remuneration aligns with national priorities. I trust that that answers the question. Thank you very much.
Thank you very much. Now, Honorable Nashinge was asking whether he can get the floor. I want to explain that in terms of Rule 85, Sub 1, when a question is put, the mover of the question is given 3 minutes to put the question, and it's only one opportunity given. The member to whom the question is posed is given 5 minutes to respond, and the mover of the question is given 2 minutes to ask follow-up question. Other members are not given the opportunity. I cannot give the floor to Honorable Nashinge. So we proceed to the next question. No, I see that Honorable Venani is here, and I promised to give a ruling on his question of point of privilege with regards to what happens after we have adopted motions here. That rule is Rule 67 in the committee rules. So it's 67. It says that the secretary will inform each ministry of the resolutions that were adopted by the Assembly and require them to report progress on implementing them within a specified time frame. And if the ministries do not comply, then the secretary, in consultation with the implementation committee, must inform the committee on standing rules, and the committee would inform the Assembly. And if the entity has not reported as requested, to 67 of the committee rules, not standing rules, yeah. So you can go and read it. I'm saying it's a very elaborate rule. It explains. But the unfortunate thing is that you go to the Committee on Standing Rules. If they have not complied, the standing rules must report to the Assembly. Then the Assembly must request the Prime Minister as head of administration to direct the ministry to comply within the last time they are given 14 days to comply. And then it ends there. So the question that arises, even from my point of view when I was reading, is if the Prime Minister gives 14 days to the ministry to comply, and that doesn't happen, the rules don't say anything. But at least there is something in the rules now. And we can think about it when we are going to review the rules if we want to strengthen. So please, when we are committees and we have submitted our reports here, we should, follow the implementation and notify the Secretary and the Committee on Implementation when these resolutions are not being implemented so that we can follow up. So that is the ruling on that. Then we proceed with the questions. Now we had just concluded the question number 72. We had already dealt with 76. So we proceed with 77 by Honorable Thomas to the Deputy Prime Minister. Deputy Prime Minister is not here. So we go to question number 78 by Honorable Motu to the Minister of Education. None of them are here. Then 79 by Honorable Likando of IPC to the Minister of Environment and Tourism. The Minister is not here. The question number 80 is by Honorable Ampanda to the Right Honorable Prime Minister. The Prime Minister is not here. 81 is by Honorable Kandorodu to the Minister responsible for Agriculture. The Minister is not here. Is the Deputy Minister delegated to answer the question? Okay, no. So the next question is 82 by Honorable Kandorodu to the Minister of Works and Transport. The Minister is not here. The next question is 83 by Honorable Fries to the Minister of ICT. The Minister is not here. The next one is 84 by Honorable Itope to the Minister of Home Affairs. The Minister is not here. The next question is 85 by Honorable Itope to the Minister of Health. Does Honorable Itope put the question?
I put the question.
Now, Honorable Minister of Health, you have the floor.
Honorable Speaker, Honorable Member, thank you for the opportunity to answer the question. Due to the similarities, I will try to answer them in sort of one answer. Admittedly, it is indisputable that our healthcare facilities are overstretched for both inpatient as well as outpatient, with limited infrastructure for patients, as well as eligible lodges, which is what we would naturally term them. Within this infrastructure constraint environment, the Ministry is currently exploring cost-effective strategies to implement locally adapted practices that allow us to balance patient-centered care and safety, as well as patients' family that accompany, particularly in terms of lodges. February 2025, the general pediatric wards within Intermediate Hospital or Shakati have been equipped with sleeper couches to improve comfort for caretakers, guardians staying with hospitalized children. In addition, a designated unit is available to accommodate mothers of neonates admitted to the premature baby unit, otherwise known as PREM unit, as a part of a commitment to promoting maternal involvement as well as community of care. It is important to highlight that many pediatric wards within the facilities are designed with cot beds, which, appropriate safe for pediatric patients, cannot safely accommodate adults. Furthermore, in rooms where space is already constrained, placing adult-sized beds or additional sleeping accommodation is often not feasible. For lodgers, caretakers, and accompanying particularly non-infant patients, where resources and space permits, efforts and due considerations are always made to attend to the needs, including the provision of meals as well as bedding. It is for that fundamental reason that the government is committed to decongesting service provision in the sector, centered on investment in new district hospital infrastructure that is built to accommodate the lodgers or the relatives that accompany. Honourable Speaker, the Ministry fully acknowledges the importance of ensuring safe hygiene shelter for patients as well as eligible lodgers. And while the management of our health facilities diligently pursue all avenues at their disposal at this point in time, the reality is that in some instances outside of Oshakati and others, infrastructure limitations might sometimes limit what we are able to put to allow for lodgers. And with that said, we then need to address that from a more preparatory point of view to ensure that when we design from district hospitals to referral and intermediate hospitals, we make provision for lodgers in the space and the design of the facilities. In particular, the maternity waiting homes were constructed amongst other initiatives of the former First Lady, Her Excellency, Madame Penyo Puhamba, as part of her noble campaign to increase access to skilled birth attendants for pregnant mothers who live far from facilities in order to stay in proximity to health facilities. To date, this initiative continues to receive the necessary support by stakeholders, local authorities, as well as ministries, offices, and agencies. According to the guidelines for maternity waiting homes, the custodianship of maternal waiting home is vested in the Ministry of Regional MURT as an auxiliary service infrastructure to advance and integrate rural as well as peri-urban development, while the Ministry of Health and Social Services has the responsibility to provide outreach services through its emergency neonatal care staff to pregnant and nursing mothers that stay in these maternal homes, as well as health inspection, of course, of the premises. And then with the final question, Honourable Speaker, Honourable Member, as I've stated earlier, providing for shelters is a shared responsibility. As of the past few weeks, myself, as well as the Minister of Urban and Rural Development, are in talks to finalize the officiation and the official handover of a maternal waiting shelter that is in Otapi, once again speaking towards the deliberations and practical solutions for lodgers in public healthcare facilities. In conclusion, the Ministry is committed to strengthening the healthcare sector and recognizes that lodgers in all facilities should have sufficient space and bedding, particularly when accommodating or following up with loved ones. Thank you.
Thank you. Honorable Itope, do you have a follow-up question?
Thank you so much, Madam Speaker. I don't have much to say. It's just to appreciate the Honorable Minister for the answer.
Thank you. Then we proceed. I'm looking for, where were we? Okay. The next question is one by Honorable Kanyemba, question number 86, to the Minister of Defense and Veterans Affairs. Is the Deputy Minister delegated to answer? Okay, does Honorable Kanyemba put the question? Is Honorable Kanyemba in attendance? Okay. Honorable Deputy Minister, you may respond.
Thank you very much, Honorable Speaker, Honorable Kanyemba, and Honorable members of this House. In your first question, Honorable Member, you would like to know what the standard criteria for promoting military personnel across different ranks in the NDF are. The criteria for promotion in the NDF is balanced. It entails a consideration of seniority, merit, training, discipline, and vacancy availability. We have boards that oversee the promotion and approve promotions at appropriate levels of command. In essence, a member of the force must serve in a given rank for a certain period of time, complete mandatory courses, maintain discipline, and perform well in the rank. As for the detailed information that you seek on the promotion for the ranks of private to warrant officers over the period of the last 3 years, let me give you a breakdown. We'll start with the rank of a warrant officer, class 1, and end with the rank of Lance Corporal or equivalent. In 2022, 64 warrant officers class 1 were promoted. In 2023, 24 were promoted. In 2024, 119 were promoted, giving a total number of 207. Warrant officer class 2, 2022, 202 were promoted. 2023, 51 were promoted. 2024, 335 were promoted, giving a number in that year of 588 warrant officers class 2 that were promoted. Staff sergeants for promoted in 2022 were 322. In 2023, 54. In 2024, 604, giving you a total of 980. Sergeants, 430 sergeants were promoted in the year 2022. 61 were promoted in 2023. 1,106 were promoted in 2024, giving a total number of promotions in that year in the same rank of 1,227. Corporals, 413 were promoted in 2022, 75 in 2023, 1,518 in 2024, giving you a total number of 2,006 corporals that were promoted during that period. Lance corporals, 478 were promoted in 2022, 78 in 2023, and 646 in 2024, giving a total number of 1,202. In total, 6,580 personnel in those ranks were promoted in those 3 years that you requested. On the average, time in rank before promotion at each level in the NDF of non-commissioned officer promotions follow a structured timeline based on leadership skills, experience, and mandatory courses. A private typically serves 2 to 3 years before promotion to Lance Corporal, and another 2 to 3 years to Corporal, demonstrating small team leadership and completing the junior non-commissioned officer course. Promotion from corporal to sergeant takes 3 to 4 years, requiring competence in section command, tactical knowledge, and administrative duties. While sergeant to staff sergeant takes a further 3 to 4 years with a strong platoon level leadership and intermediate non-commissioned officer training. Advancement to warrant officer class 2 generally requires 4 to 5 years, with proven ability to supervise multiple platoons or act as company sergeant major and warrant officer 2 to warrant officer class 1, averages around 4 to 5 years, often delayed by limited vacancies. Warrant officer 1 leadership appointment to regimental or formation sergeant major demands exceptional leadership, operational experience, and senior non-commissioned officer courses. This is the practice across defense forces in the region and worldwide. You would also like to know, Honorable Member, in your last question, what specific reforms are being implemented to address the alleged morale crisis in the NDF. As I indicated earlier, my office is open for the Honorable Member to come and have a discussion with me over these issues. There will always be a cup of tea. I would like to have a look at the study or research that you undertook, Honorable Kanyamba, to get to the conclusion that there is a morale crisis in the NDF. As far as we know, the morale of the NDF soldiers is high, it is fine, and our men and women are ready and committed to defending the country and its interests at any given time. The delays in promotions are not by design. It is due to factors such as insufficient funds and unavailability of vacancies. As you may be aware, the higher the corporate ladder goes, the less the positions become. I thank you, Honorable Kanyemba. I thank you, honorable members. I thank you, Honorable Speaker.
Yes, thank you, Honorable Minister. Now, since Honorable Kanyemba is not here, is Honorable Kanyemba here? He's not here, ne? Someone put the question on his behalf, so there will be no follow-up question. We proceed to question 87. No, there is no opportunity given to another person other than the person who posed the question. So if you put it on behalf of the person, that's the rule, unfortunately. Yeah. So the next question is 87 by Honorable Brinkman to the Minister of Health and Social Services. Does Honorable Brinkman put the question? Okay. Your Honorable Minister, you have the floor.
Honourable Member, to answer the Honourable's question, I'll start with the question 1. Business re-engineering is a value proposition which defines what we would call present-day life and reforms. The initiative is an integral part of the overall policy commitment by the government to provide inclusive as well as efficient service delivery. In this respect, the Ministry is constantly harnessing opportunities for innovation or opportunities to challenge the status quo. The following are amongst the strategic guidance informing the implementation of the decongestion strategy. Firstly, primary healthcare guidelines. The Ministry's primary healthcare approach defines a minimum package of services at each facility. Health centers, district hospitals, ensuring essential care is provided locally and aims to alleviate congestion at referral as well as tertiary hospitals. Then workload indicators as well as staffing norms. A nationwide staffing assessment using WHO method was initiated since 2022 to match the staffing to actual workloads. This applies across all public health facilities, and this is in order to reduce bottlenecks caused by staff shortages. And then infrastructure investment and provision of specialists. Capital funding has prioritized expansion of specialized services, for example, intensive care units, renal dialysis, oxygen plants at district hospitals to increase capacity as well as reduce referrals to intermediate hospitals. And then universal health coverage policy. The Ministry is committed to attaining the goals of universal health coverage, which calls for all people to have access to quality health care when they are in need of them, without suffering financial hardship. This policy bid presupposes that services are provided at faster turnaround times. Then with regards to question 2, Honourable Speaker, suffice to state that the Health Professions Act number 16 of 2024 regulates the registration and licensing of health practitioners. The Act also outlines the powers and functions of the Council and the qualifications required for registration and the prohibition of practicing without registration. In essence, this Act provides a comprehensive legal framework for the regulation of health professionals in Namibia, promoting public safety as well as ensuring the delivery of quality healthcare services. In regard to the decongestion strategy at the Cathedral Health Centre, the private doctors are working under the overall supervision of the senior medical officer that is in charge at this facility, with the support of the chief medical officer at the regional office. These medical doctors are working alongside other full-time government medical officers at the centre. They are providing health services within the established protocols as well as quality standard guidelines. I wish there to reiterate the Ministry's utmost appreciation to these heroes and heroines of our country who stepped up since day one to offer their services. Regarding question 3, Honourable Speaker, Honourable Member, this question is of fundamental importance. We recognise that. The health and social services provided under this initiative are in line with the established standards for the proposition, and this is to provide these services at a faster turnaround time, of course with optimal quality of care. The key levers for such value proposition include digital approaches, which would inform the rollout of the initiative to other regions of the country. In particular, the following standard categories of services are included. Firstly, primary healthcare services for the screening and treatment of ailments, antenatal, postnatal care, family planning, neonatal as well as postnatal assessments. general medical services, outpatient consultations, minor medical procedures, as well as follow-ups, diagnostic support, clinical interpretation of available radiology, as well as laboratory results, and then minor surgical support being basic procedures such as wound care. With regards to question 4, Honourable Speaker, Honourable Member, it is important to note that the use of volunteer doctors is just one of the initiatives of a broader decongestion strategy. The Ministry has a mechanism in place to foster teamwork, reduce overly committed hours per individual doctor through shifting rotations, promoting mutually beneficial relationships, and the acknowledgement of services provided. The following are amongst the initiatives that are utilized by the Ministry. Firstly, the fast tracking of the recruitment of staff, continued advocacy for a responsive recruitment budget. Filling all funded positions will drastically reduce the burden on current staff while advocating funding optimally going forward. With that, I wish to state that the Ministry is in the process of recruiting more health workers before the end of the year. Number 2, the use of memoranda of understanding or service level agreements to formalize commitments and expectations. Number 3, recognition and appreciation of the services rendered. Number 4, administrative as well as logistical support, ensuring availability of infrastructure, supplies, as well as support to staff to enable effective service delivery. And then lastly, incentive substitutes such as providing transport, meals, and accommodation where feasible. In addition, according to the National Policy on Community-Based Healthcare of 2008 regarding volunteerism, it is promoted and supported as a cornerstone for promoting community participation as well as ownership. The goal of this policy is to empower and motivate communities to initiate as well as strengthen their own community actions and household practices in order to promote health, well-being, as well as reduce mortality. Furthermore, for these past years, the Ministry of Health and Social Services has successfully implemented the National Medical Outreach Service. This program focuses on increasing access to medical services to a wider community, particularly targeting the rural areas. This is achieved by mobilizing healthcare professionals from both private and public sectors to make their services available on a voluntary basis to those communities. The medical outreach program, which has been ongoing for years, is aimed at providing specialized service at district hospitals as opposed to referring them to the national level, bringing it closer to the people and also conveniently offering an opportunity for mentorship to the medical teams. Regarding question 5, Honourable Speaker, Honourable Member, it is an indisputable fact that the vast geography as well as the low population density negatively affects service delivery dynamics, and that is one that we often have to work around in order to ensure efficiency. This means that the facilities established in different parts of the countries, even in areas where the population numbers are relatively low, but sometimes with corresponding high healthcare staff shortages. The Ministry has introduced rotational shift lunch hours to enable continuation of services and cut down on waiting times, an initiative which has received a positive response from patients. As stated, the lessons to be learned from the implementation of the piloting of the decongestion strategy in Khomas region will inform the expansion of this initiative to other areas. The commencement with the volunteer doctors was merely but phase 1, which we did then note during the media release that would be augmented by extending the service hours at other facilities, which has been done and continues to be done. Lastly, Honourable Speaker, Honourable Member, regarding question 6, risk and security considerations are always taken into account at health facilities. Cathedral Centre has security personnel contracted by the Ministry. Necessary arrangements are made with law enforcement agencies to complement facility specifications, provisions for security as well as risk mitigation due to the high volume of patients expected during the extended working hours. In particular, the management of Cathedral Health Centre has the capacity to provide transport to volunteer doctors as the need arises. To conclude, Honourable Speaker, Honourable Member, the Ministry will continue to promote as well as strengthen service delivery in the sector with the necessary rhythm and intensity. This is vital in ensuring that we reach more people in Namibia with the quality care that they deserve, enabling them to access services in a timely manner. The pilot, I reiterate, was only but the first step in what the ministry is currently active with to ensure that we provide quality health care to all people. Thank you, Honourable Speaker.
Yes, thank you, Honourable Minister. Does the Honourable Brinkman has any follow-up question?
Thank you, Honourable Minister, for that reply. I would just want to know, since the inception of the program, was it really effective? Was it effective? Did it yield the results that we longed for, the decongestion of the long waiting of the patients? And are we still having the same doctors that started the volunteering? Are all the doctors still with us? I also want to know if it happens that they would want to give any feedback, what feedback mechanisms is the ministry having in place for these doctors? Or is it through the SMO that they do that? I would just want to know that clarity. And lastly, as I stated in the statement, Oguriankava Clinic was supposed to start also the 24-hour operation on the 1st of August. But as we speak, that is still not the case. Can the Honourable Minister please clarify what unforeseen circumstances has happened, that it still didn't happen? Thank you very much.
Thank you, Minister.
Thank you, Honourable Speaker. Thank you, Honourable Member, for the follow-up questions. I'll start first with a question regarding whether or not it was effective. So the approach we've taken is very research-based. We told the team when we started the pilot that we wanted to hear from the patients so that we have an informed data that we use, and so that we don't just come to Parliament and tell you it's effective without it being researched and it being proven in terms of data and statistics. So prior to the commencement of the pilot, we had a questionnaire that we gave out to patients as well as healthcare workers. This questionnaire was filled and it was used to form a pre-pilot study. After the pilot, we will then once again proceed to give the same questionnaire, as you're aware in terms of research, same questionnaire to patients, doctors, and those making use of the facility in order to be able to actually assess research-wise, like you said, whether or not it is effective, so that you don't just have to take my word, but you know that the patients on the ground have actually stated so. And once this is available, it will be published for the public, including yourself. Feedback to the Ministry of Health and Social Services in terms of report mechanisms, and I'll tie it into one question. Are all the doctors present that started with us? No, but similarly, there are new doctors that have been added as well. Circumstances change, and starting at one place doesn't mean that one has to continue for the entire year, for 10 years to come. Circumstances do change, but similarly, as one or two have left, we have seen more join the boat. With that said, the last question, I believe I tied into that answer, but perhaps the Honourable Member can let me know if there's something I didn't answer. Thank you.
Yes, thank you very much. Now we proceed to the next question. That is the question. Okay, so the practice is to give one chance, please. I will give because of the importance, but please, I want the members to note that we give one chance for supplementary questions, but we cannot have a back and forth where, yeah. Oh, okay. Yeah. Okay. So the minister didn't hear the last question. Is that what the minister is saying? Okay. So the member is saying the minister did not answer the last question?
Yes, Honourable Speaker.
Okay.
Regarding Okuriangava, thank you for the reminder. Regarding Okuriangava, I wish to state that we... I actually grew up in that area, for your information, so fact-checking is important. With that said, Honourable Member, allow me to very quickly just highlight with regards to Okuriangava, I echo your same sentiments. It did take us a while longer to contract the doctors, employ the doctors. Okuriangaba particularly, including Okahanja Hospital, are part of those that we're now busy recruiting the doctors. So not voluntary doctors, recruiting full-time doctors. We did communicate with the facilities as well as the healthcare workers to state that we're expecting the finalization of that HR process to be completed within October. Thank you very much.
Very good. Then we proceed to the next question. It's one by Honorable Karonda to the Minister of Urban and Rural Development. There. No. What about Honorable Kandorodo? Is Honorable Kandorodo putting the question on behalf of Honorable Karonda? The question 88. Honorable Kandorodo, are you putting question number 88? You are not Honorable Kandorodo. No. So, okay, the Deputy Minister, are you delegated to respond?
Well, powers vested in me. Enough. And Dorodu, I thank you for putting this question on behalf of Honorable Karonda. Response to question number 1. The city of Windhoek acknowledges the historical context of the transaction F number 3218 was sold by the city of Windhoek in 2004 under the group-based land delivery model meant to enable access to land for low-income residents. The sale was executed under a structured agreement which outlines in clause 25 of the attached sale agreement that the responsibility for development, including servicing, rests with the purchaser, which is the Unongo Oye Nkokuyame Group B. Apologies for the pronunciation. The neighbor is not helping me too much here. Clause 25.10 in the agreement specifically requires that minimum level 1 sanitation service, such as a block of toilets, be installed within 3 months of transfer, and that interim effluent disposal plans be submitted to the municipality. The clause also highlights that water, electricity, and refuse removal services are not guaranteed unless the purchaser arranges and finances them. In addition, Annexure D and the clause 36 of the town planning scheme prohibit the occupation of development of unserviced haven without municipal approval. That said, we are mindful that the group has been affected by deepening socio-economic vulnerabilities. Answer to question 2. On the matter of debt cancellation, I wish to clarify that all municipalities operate within the financial governance framework set out by the Local Authority Act number 1992 and the municipal internal policies, which restrict the arbitrary cancellation of revenue streams such as water charges. However, clause 25.8 of the agreement provides that the Block F was intended for shared occupation by a maximum of 46 eligible households, all of whom must not have benefited previously from municipal land or housing subsidy. Compliance with this clause is key to accessing support from the municipality. As per the Council Resolution of 2023, CR 291-11-2023, in 2024, the group benefited from a 50% interest reversal amounting to 19,888.46 combined on both their accounts. This demonstrates that cities' willingness to provide some financial relief were feasible and in line with the policy. Unfortunately, due to the current setup of the group, the pensioner members cannot individually benefit from any write-off because the account is a general group account and not linked to the individuals. As such, it is impossible to determine which portion of the debt
belongs to which member? Last question, the original agreement clearly states in clause 25.7 that the property was acquired as a Block F, and the purchaser carries full responsibility for servicing, subdivision, and associated legal processes. The agreement also contained a preemptive clause, clause 25.8.2, giving the city the first right of refusal in the event of resale, and requires the registration of multiple municipal servitudes, clause 25.4. Nonetheless, the ministry recognized that collective ownership is only a first step towards formal tenure security. We are currently strengthening support under Urban Land Development Support Program, which facilitates access to town planning and surveying assistance, coordination with local authorities for servicing design, and support towards eventual registration of individual title deeds. We encourage the group to formally engage the ministry and city of Windhoek to determine their readiness and compliance status, as these are prerequisites for qualifying for such assistance. As I'm concluding, the situation of Onongo, Oye, Nkuyame B Group illustrates the complex challenges associated with informal upgrading and group tenure. The original agreement thus places development obligation on the group itself, but the reality on the ground, service access gaps, and tenure insecurity necessitated a more compassionate yet structured and intergovernmental approach. I so submit, Honorable Speaker.
That question was put on behalf of Honorable Karonda, and therefore there will be no follow-up question. Then, okay, a copy, please. In fact, all the honorable members who have responded should avail the copies to those members that want to have them. The next question is 89 by Honorable Karonda to the Minister responsible for Agriculture. Is anyone delegated to? Okay, Honorable Minister of Agriculture, you have the floor.
Thank you very much, Honorable Speaker, and thank you, Honorable Kandorodu, for putting this question forward on behalf of Honorable Karonda. It has been standing for quite a long time. So let me, in posing this question, Honorable Karonda stated that there are 250 farms measuring time.
Yes, please set the time. Set the time, Secretariat, please.
Thank you. When posing his question, Honorable Karonda stated that there are 250 farms measuring about 1.2 million hectares that are foreign owned. And his question 1 and 2 are and 3 are related, so when I answer 1, I'm answering 3 as well. Now, just to recap, one of the resolutions of the second National Land Conference was that foreign-owned agricultural land should be expropriated with just compensation. So, following this resolution and the adoption thereof, the ministry developed standalone expropriation criteria, and this is No, it's not me. Sorry about that. I was saying that following the adoption of those resolutions, the ministry developed standalone expropriation criteria, which were gazetted, and those will be guiding the expropriation process. Furthermore, the ministry conducted an exercise to identify foreign-owned land. And we have identified 243 farms with a combined size of 1,159,826 hectares of commercial agricultural land as foreign owned. We have been on record in various platforms, including our reports to the high-level committee, which is overseeing the implementation of the Second National Land Conference on these figures. We are, with the tabling of the land bill, once that land bill is passed, our first point of call is to target the farms owned by foreigners but that are absent, or the land owned by foreigners which is not productive. I must state that some of us believe that expropriation is the best solution to the land reform question in Namibia. Our experience as a ministry has taught that expropriation takes long because of litigation, and it is very expensive and does not necessarily provide the result at the time that you need the land. It is also our conviction that farms that are on full production and provides employment to a greater number of Namibians may not be targeted initially for expropriation. However, it must be also noted that on average, the price of commercial agricultural land per hectare in Namibia nowadays is no less than 3,500 per hectare. So to expropriate 1.2 million hectares will cost the state over 4 billion Namibian dollars. On the second question, whether we have any pending requests or application by foreigners to acquire any form of land in Namibia, I would like to say yes, we do. We have 8 applications made in terms of Section 58 of the current Commercial Agricultural Land Act. And in terms of this current law, foreign nationals shall not acquire or lease agricultural commercial land without prior written consent of the minister. Out of the 8 applications received, 6 of them were fully assessed, while 2 remain pending. Of the 6 that have been fully assessed, 3 were for leasing of land, while 3 are for acquisition of land. And those who are looking to acquire the land, one of them wants to mine uranium on that particular farm, and the other 2 want to construct a green steel factory and a green hydrogen production facility, while the last one wants to acquire a lodge as a going concern. Honorable Speaker, honorable members, I can inform this House that the government is committed to address the historical injustices related to land access, land ownership, for the benefit of previously disadvantaged Namibians. During the last financial year, the ministry acquired a total of 11 farms with a combined hectare of 41,291 hectares at a cost of over 115 million Namibian dollars. So you can see how expensive the process is. In addition to this, we have also requested and we have obtained approval for 100 million Namibian dollars targeted specifically to acquire farms for farmers in corridor and generational farm workers, and resettlement of Botswana of Namibian descent. To this end, 13 generational farm workers have been resettled and 6 are pending resettlement during this financial year. In addition, we have also acquired additional farms adjacent to Aminus, Obitoto, and Oshimbingwe communal areas to relieve grazing pressures on these communal areas. In addition, a historical milestone was achieved last year when a communal area was established in the Thomas region for the very first time on a land measuring 8,132 hectares. This land has been allocated to the Komanin Traditional Authority for the resettlement of their members of the Traditional Authority. Honorable members, Honorable Speaker, the third question that I would like to address is the issue of fair market value. Honorable Karonda asked whether fair market and just compensation is fair and just, or whether it's an impediment to land reform. Firstly, the fair market value refers to the price a willing buyer is willing to pay a willing seller in an open market. It is determined by comparing the particular property, to similar properties that have been acquired in recent times. The highest and the best use of the property is a key factor in determining its market value. Consideration is also given to the value of buildings, if any, on the land, structure, and improvement thereof. Honorable Speaker, honorable members, from the above scenario, including the issue of expropriation.
What is the matter? Yeah, okay, I know that the time is now over, but the minister is responding, and I will exercise my discretion to allow a minute or two to the minister. But I think this also highlights the importance of summarizing our questions. If you ask a long question with 5 sub-questions, then the minister needs more time to respond. So please, I extend the time for the minister. The minister should proceed.
Yes, thank you very much. I will summarize.
Summarize your questions. Honorable members, honorable members, honorable members, honorable minister, proceed, please.
Honorable Speaker, honorable members, owing to popular demand and given that the answers will be submitted fully in writing, I would like to conclude by saying there was a question whether.
Okay, please, the minister is protected. Minister, you may proceed.
Okay. There was an issue whether expropriation is more expensive than the willing buyer, willing seller principle. One of the key challenges associated with the methods of acquisition is that landowners are not offering their farms
Somebody's phone is too close
to the state in good faith. In the last financial year, 26 farms were withdrawn just before the state could exercise its preference right, including the issuance of a counter offer to the farm owner. Again, this current financial year, a total of 27 farms were withdrawn by the owners in the same fashion. This happened when the state offer low price than what they want. So rather than selling at a low price, the owners will withdraw that farm, keep it in the market, keep it for themselves and bring it back in the market again. So this is the challenge insofar as acquiring on the basis of a willing seller, willing buyer principle. Honorable members, with regards to whether fair and just compensation is an impediment, I would like to draw the attention of this House to Article 16 of our Constitution that guarantees the right to property, with paragraph 1 providing everyone with the right to acquire, own and dispose property. Namibia also in addition has ratified International Convention on other rights to own property. However, Article 16(2) of our Constitution makes provision for expropriation of property. It provides for the state or competent body authorized by law to expropriate in public interest, subject to payment of just compensation. So this is the issue. Expropriation is permitted, but you must pay just compensation. Honorable members, Honorable Speaker, the last question, which was asked by Honorable Karonda, was for the Ministry to provide a comprehensive list of all land owned by foreign nationals. I must point out, Honorable Speaker, that as a ministry, we don't have a mandate to reveal private information related to property ownership. However, honorable members interested can go to the registry office, the deed registry, and find out for themselves which farm is owned by whom. Thank you very much, Honorable Speaker and honorable members.
Yes, thank you, Honorable Minister. Now, that was a question put on behalf of Honorable Karonda. So there will be no follow-up question on that one, but maybe I see that there are many queries about that aspect of the other members not giving the opportunity to pose follow-up questions after an answer is provided. So the formulation in the rules is like this. When you look at the table there, under Rule 85 sub 1, then you go to the questions. Ne? It says a mover of the motion or of a question is given 3 minutes per question and is given only one opportunity. That's why it says 3 minutes per question, but frequency once. And then it says a member in answer to the question. Now that is the minister who is responding to the question, is given 5 minutes to respond and is given one chance to give that response. Ne? And then it's a mover, not any other member, mover of the question in reply to the answer is given 2 minutes once. So if you are not the mover, you are putting the question on behalf of another person. That is not given, you are not given. But wait, honorable member, now if you want to compare, to understand that there is a distinction there, just look at where it says, for example, motions. So you have a mover of a motion that is given 15 minutes, then the leader of government business 10, leader of official, and then other members 5 minutes, other members. So it doesn't mean that because you are the mover of the motion, you are the only one that is given the opportunity. So other members. But when it comes to the question, it doesn't say other members, it says mover. So that opportunity is only given to the mover. Yeah, otherwise, if it is given to any other member, then there will be a discussion after a question, which is not the intention. The intention of the rules is that a question is posed, then a question is responded to, and if there is a lack of clarity or there is some gaps, the person who posed the question can come back to seek clarity, and then the answering member would provide a clarity. That is what the intention is. Okay, a short question, let him go ahead if he wants clarity.
I'm happy
But you also do that, honorable member. Yes, especially you. No, all of us are members, and the rules apply to all of us equally. Yes, Honorable Member, you have the floor.
Very good, Honorable Speaker. I'm glad you brought it on the floor. If what you are saying is correct, now what about if you go to Rule 130 up to 134?
130?
130 up to 134. This is addressing the general rules of questions and so on. Ne? And I thought that should be addressed under those rules specifically. So it's mute on that.
No. The table okay.
No, the table is just time allocation. But here it is giving us how questions and answers should be dealt with.
So, Honorable Member, can you point me, wait, I'm asking for clarity. Can you point me to a part of those provisions between 131 to 133 that says any other member can pose a follow-up question after an answer is provided?
No, I'm just referring to you because this is where the questions are addressed, how we should go about the questions and the answers.
Yeah, okay, Honorable Member.
So, perhaps these rules are coming as far as 1994. It's about time we really relook at them and change them. Because some of the issues that are being asked are really questions of national interest, and we all have should be given an opportunity to contribute and assist perhaps even the minister to understand from a different angle. Thank you very much.
Thank you, Honorable Member, but I take note of what you are saying, but the point remains that we have a provision for motions where we can raise issues for discussion, and we have a provision for questions. And the question session cannot be turned into a debate. It cannot. Yeah. Now we proceed, honorable members. The next question is one by Honorable Nashinge to the Honorable Minister of Home Affairs. Unfortunately, there is no one from the Ministry of Home Affairs. Now we proceed, question number 92 by Honorable Kandorodu to the Right Honorable Prime Minister. Is there anyone delegated by the Right Honorable Prime Minister to answer the question? Okay, then we proceed to question 93. Honorable Hengari knows there is no one delegated. Now we proceed to question number 93 by Honorable Kandorodu to the Minister of Health and Social Services. Does Honorable Kandorodu put the question? Honorable Minister, you have the floor.
Thank you, Honorable Speaker. Thank you, Honorable Member, for the question. During COVID, we needed extra staff. Following the approval of the temporary structure, the Ministry recruited additional staff, guided by the availability of funds allocated to the Ministry for this. 948 staff members in job categories of grade 15 to grade 12. These contracts were extended based on the severity of COVID-19 at that particular point in time. Noting that this was a significant undertaking, the response was a collaborative effort, and so then the Ministry of Health and Social Services approached developmental cooperative partners to join hands and support the cause. With that said, we were able to recruit additional staff. Additional 517 volunteers were recruited with the financial support from partners. Therefore, the total number of volunteers in those categories, grade 15 to grade 12, were 1,465. When the pandemic slowed down, it was no longer prudent to continue with the same number of human resources, considering that they were hired to relieve pressure during COVID, and the funds were allocated due to the emergency situation. Hence, the Ministry at that point in time terminated the contracts of the COVID-19 volunteers. Initially, that was done on the 31st of October, 2022, and later, after due consideration, there was a 2-month extension until the 31st of December, 2022. Now, although the numbers of cases of COVID-19 further declined, the Ministry considered that it was essential to recruit some of these human resources for health in permanent positions, so that in the event that the pandemic resurges, the Ministry would have adequate human resources capacity to respond adequately. Since the volunteers in the jobs in question, categories 15 to 12, made up the majority of the COVID-19 volunteers cohort, the Ministry decided to give priority to these volunteers to fill some of these critical positions out of the then existing 871 funded vacant positions in grade 12 to 15. considering, of course, the expertise that were needed for those permanent positions. Honourable Speaker, Honourable Member, it is important to note that the Ministry requested and received approval to fill vacancies to the extent that they are funded. The approval given in October 2022 clearly indicated that not all COVID-19 volunteers would be recruited, as only the critical funded vacant positions would be filled. To this effect, the Ministry of Health and Social Services managed to recruit 715 COVID-19 volunteers in critical positions. It thus suffices to say that when equivalent funded positions arise now or in the future that these particular staff qualify for, consideration would be given to the volunteers cohort. Regarding question 2, Honourable Speaker, Honourable Member, as stated in my response above, the Ministry recruited 715 out of the first funded 871 vacant positions that fall under grades 12 to 15. The recruited number was limited due to funding constraints, as highlighted. The institution of temporary positions, I wish to highlight, does not translate to automatic permanent absorption. However, due to the fact that we recognize that livelihoods are impacted where there is no retainment, consideration has been given above the initially retained 715 to state that where permanent positions arise that these members qualify for, they will be given priority. Regarding question 3, Honourable Speaker, Honourable Member, the Ministry acknowledges the good service of the COVID-19 volunteers provided, particularly under difficult circumstances. However, the Ministry does not have a separate budget for recruiting COVID-19 volunteers. This falls under the same HR budget of the Ministry of Health. Therefore, COVID-19 volunteers, like others that are currently right now in the pool, including unemployed nurses and others, are in the position now to apply that the Ministry, when the Ministry advertises for positions that they perhaps meet requirements for. Regarding question number 4, Honourable Speaker, Honourable Member, we acknowledge the shortage of healthcare workers in the public health sector. We wish to inform the Honourable Members that multiple measures have been put in place to address. It is not a one-stop shop, unfortunately, because of the number that we are able to absorb at once. And therefore, the Ministry has put in place a 5-year plan where recruitment will be on an annual basis in order for us to ultimately absorb all the unemployed staff. With that said, a part of this measure is also ensuring more efficiency in the Ministry, part of which, as mentioned, through direct procurement, where savings are made, where now we are able to hire more staff before the year ends to ensure better efficiency. And so the answer to that question would be, number 1, a staggered approach, a planned strategic approach for the next 5 years, where staff will be hired on an annual basis according to funds available. But in addition to that, the Ministry is employing all measures to ensure that we become more effective cost-wise, so that with the cost savings we can hire more healthcare workers. Thank you, Honourable Speaker.
Kandorogo has any follow-up question?
Thank you, Honourable Speaker. Honourable Minister, the follow-up that is there, the volunteers are saying the response that they got from the Ministry is that they must go and register at the Ministry of Justice and Labour portal, where each and every Namibian's unemployed is allowed to register. So in that case, when there is a vacancy at the Ministry, the HR pick up anybody from that list. Consequently, they are excluded from that practice. So from those that have been employed, maybe the 715, as you are indicated, let's say at the mortuary, the Ministry need to employ a porter, or how do you call it? So somebody is responsible with mortuary. A position that they have volunteer over a period. The person who have been picked up from the system of labor was never among them, is not among the list. So they are requesting for them to have a classified list for them only, and they themselves can compete with one another, they wouldn't mind if they lose against one another, rather than picking up somebody else from outside who never volunteered during that course of period. So that's their position. Cabinet Speaker.
Honorable Minister.
Thank you, Honourable Member, for the follow-up question. We've received quite a few of these remarks from the public as well, saying, and I think ultimately what you're saying, trying to summarize it, was that they should be prioritized, considering the fact that they served during a time we needed them the most. When we need people and we now have money to employ, we should prioritize them. I think that's ultimately what you're saying. Now, we've received a lot of those comments from the public, as well as not just the rest of the people that remain unemployed in that sector, but from the general public as well. With that said, what I do wish to highlight is that there are other sentiments as well from the rest of the unemployed that were not a part of that group of people that now say, yes, but at least they had an opportunity at some point or another. We have been unemployed. We've never gotten an opportunity. And so that's where the sentiments come in to say, in as much as what you're saying makes a lot of sense, the other side of things also states that, you know, we've been unemployed for much longer, say some people. Why are you prioritizing the same people you gave an opportunity to? Now, with that said, exactly. Yeah. So with that said, Honourable Member, I am very much willing to, it's a very important question, and I'm willing to have further discourse, if you are, and to find a solution for that benefits the people. Thank you.
Thank you very much. And I just want to say, I can see some issues are very topical, and I want to remind members that when an issue is of interest, and the answer has generated more issues in your mind that you want to have discussed, you can move a motion, so that we have an opportunity to discuss the issue instead of trying to debate through questions. Yes. No, I'm just explaining what the rules are saying. To say you cannot debate an issue through questions. That's all that I'm trying to say. Now we go ahead. We go ahead, honorable members. And the next question is one of it will probably be the last because it's almost knock-off time, is one by Honorable Nashinge to the Minister of Home Affairs. The Minister of Home Affairs is not here. Then the next one is by Honorable Kandorodu to the Right Honorable Prime Minister. Has the Prime Minister delegated someone? What about 94? We are at 94. Oh, okay. So we are at 94. The question is by Honorable Haitota to the Minister of Urban and Rural Development. Yeah. Yes, okay. Can I explain that? The rules are saying if the minister was not in when the question was put, the presiding officer can go back to that question to allow the minister to answer after we have gone through the question. So we first have to go through the questions. Now, Honorable Haitota, Honorable Haitota to the Minister of Urban and Rural Development. Is Honorable Haitota here? Has he delegated someone to put the question? Okay. Is the Deputy Minister delegated to respond? You now have the floor, please.
This is my day, Ina. This is my day. With all the powers vested in me. Honorable Speaker, honorable members, let me start by responding to the first question. Compat is a declared settlement area. Under the administration of Otondonjuba Regional Council, the settlement area was declared on the 15th May 2006 as per Government Gazette number 3213, Government Notice number 72 and 73 in terms of Section 13 of the Townships and Division of Land Ordinance 1963, Ordinance 11 of 1963. No, Kombat has not been considered for proclamation as a town or village council. The proclamation of a settlement area is a local authority, or town or village council is a process subjected to several requirements to determine whether indeed the area can sustain itself. When it is deemed necessary to proclaim any settlement area as a local authority, the process is initiated by the regional council after it ascertains itself that the local economy can sustain the local authority once it is proclaimed. Question number 2. Kombat is a small settlement area surrounded by commercial farms, which is making it difficult to be expanded to allow future human settlement. The planned township, which is the only available land for the settlement area, consists of 284 acres, of which 22, mostly public open space, belong to the government and 262 are privately owned. The 262 acres are developed, and most of these houses, which are privately owned, are occupied by tenants who are leasing from the owners. There is no individual collecting funds from the residents because of municipal services offered to the residents. If there is a fund being collected by a private person, then it is perhaps for leasing private property, to which the council has no control over. Ojonojuba Regional Council, in terms of section 32, subsection 1A, I'm getting my brother Vinani, of the Regional Council Act of 1992, as amended, is mandated to manage and control the settlement area as if the regional council is a village council as defined in section 1 of that act or such settlement area. Since 2021, that region, the Ojonojuba region, regional council, has been administering Kombat settlement. A prefabricated office was constructed and staff members are appointed. On the 21st July 2022, this office was officially inaugurated by former Minister of Urban and Rural Development, Honorable Erastus Uthoni. As per Decentralization Enabling Act number 233 of 2000, Settlement Development Committee was established. They meet quarterly and discuss issues of service delivery as well as development. Last question, how much money has been collected from residents or businesses in Kombat Town since the resumption of mining activities or private control? Like I indicated before, the council is not in control of funds collected for leasing properties which are privately owned. Since these are private transactions, my brother, what structures or legal provisions exist to audit such financial activities and protect the community's interests? As I have highlighted earlier, the council does not have control over the transactions executed by private individuals. These are not government transactions, hence government has no mandate to audit private businesses. Any auditing or oversight of such private operations will be subjected to national laws governing private companies, such as Companies Act and relevant financial regulations. Lastly, why has Kombat not been declared a town or local authority, despite historical relevance and current economic activities? In terms of section 32, subsection 1A of the Regional Councils Act, as amended, settlement areas are managed and administered as local authorities under the jurisdiction of regional councils. Typically, such areas are first established as settlements and may only be upgraded to local authority when they meet specific criteria, including sufficient population size, infrastructure development, and proven economic viability. Although Combat holds historical significance and has seen economic activities in the past, the recent suspension of operations by Tricon Mine Limited in January 2025 has resulted in reduced economic activities in this area. As such, the conditions required for an upgrade to a local authority are currently not met. The area remains under the administrative care of the Regional Council, which continues to monitor its development and potential for future upgrading once economic and social indicators improve. Lastly, what actions are there? The Ministry, through Regional Council, is actively working to ensure the residents of Combat are protected for informal governance, financial exploitation, and service neglect. It is important to note that Government of Namibia currently only owns limited portion in that area, 22 properties to be specific, with the deeds within the Combat settlement, meaning most of the land and houses are privately owned. As such, residents rent houses from private entities and pay rent accordingly. To address this situation and promote secure, affordable living conditions, the Regional Council, in collaboration, with the Ministry, submitted a request to Ministry of Agriculture, Water and Land Reform 2 years ago for allocation of land to enable the construction of affordable housing for the residents. The Ministry, I'm answering your question, the leader, remains committed to support the acceleration Yes, I will be finished in half a minute. The Ministry remains committed to supporting the acceleration of development in Combat and is working towards upgrading the settlement to improve governance, service delivery, and living conditions for our communities. I so submit, and thank you for your kind attention.
To ask a supplementary question. So that concludes the discussion on that question, and it is now knock-off time. It's 1 minute to go, and therefore I ask the Deputy Prime Minister to move that the House adjourns until Tuesday. The equipment is objecting.
When the time of beginning, I have been here watching the time, the clock, every time, every day, the whole week. Yes. We came late here. We start 1440, 1445, 1446, 47. Let us keep on the time. I think it will be good for us. Every time I'm sitting here writing,
when the House is
thank
coming
you,
in.
Honorable Member.
Thank you.
Now, Honorable Deputy Prime Minister, let me just say something. I think the member is not wrong in saying that we start late every day. But that is because in terms of the rules, we need to have a quorum, at least a deliberative quorum in order for us to start. Until the presiding officer has confirmation that we have a deliberative quorum, I will be sitting in that room waiting for that quorum to come. And the rules actually say that if we have to wait for a certain period and we don't get the quorum, the presiding officer must come and call off the sitting for the day. So I agree with the honorable member, but it's up to the chief whips to urge their members to arrive on time so that we have a deliberative quorum, at least to start our proceedings. Now, having said that, Honorable Deputy Prime Minister, we are now past the knock-off time, so
Yes.
we will now arise on automatic adjournment.
Thank you.
Yeah, thank you. Until next week, Tuesday.